The North Korean media have been denouncing the South Korean government ahead of the upcoming Moon-Trump summit in Washington. Here are some of the motivations behind their public criticism.
Nothing but unrealistic, empty words. That's how North Korea's Uri Minjokgiri described the South Korean Ministry of Unification's plan to improve inter-Korean relations. The North Korean state-affiliated website also blamed Seoul's so-called spineless responses to Washington's pressure for the stalled cross-border exchanges. The South Korean government's disclosure of a joint study on North Korea's railways and roads was also blasted as a rude action. North Korea's official newspaper Rodong Shinmun upped the attack by saying that South Korea's solo military exercise is an act that negates the Inter-Korean Declaration. Many experts believe that the North Korea media's mounting pressure on the South Korean government has to do with the meeting between Presidents Moon Jae-in and Donald Trump in Washington just a day away. Apparently, Pyongyang is asking Seoul to step up its efforts to convince Washington to ease sanctions on North Korea.
우리 정부에 대한 불만의 표시를 하면서도 한미 정상회담 앞두고 정부가 미국을 설득해서 합의 사업들이 잘 이행되었으면 좋겠다는 기대감을 동시에 밝힌 것으로.
Some experts speculate that Pyongyang may be calling on newly appointed South Korean Unification Minister Kim Yeon-chul to take more progressive measures for robust inter-Korean economic cooperation.
The city of Yeon-chul launched the first-ever public Medicare system in which even the homeless as well as the low-income class receive free assistance for cancer treatment. Patients without family members or guardians are provided with caretakers, and those with terminal cancer are being treated in the hospital's palliative care program.
Life has been tough for Chun Mi-kyung since her divorce. Recently, she was shocked to learn she has colon cancer. But Chun was able to undergo surgery free of charge just 9 days after the diagnosis. This was made possible by the Cancer Patient Subsidy Program Incheon Medical Center began implementing for the first time in Korea this year.
그런 경제적인 부담이 없으니까 지금 마음이 너무 편해서 병이 완쾌될 것 같아요. 잘 진행하고 있어요.
The cost of cancer treatment and surgery is subsidized for the homeless, the low-income class, and the working poor in the lower 50% of the National Health Insurance Payment Bracket.
다른 병원으로 이송을 하게 됐을 때 그쪽에서 생기는 비용까지도 상당 부분 지원을 해드리고 있습니다.
Back in 2011, Incheon Medical Center became the first hospital in the nation to provide caretakers for patients with no family members and those who cannot afford caretakers. So far, more than 100,000 patients benefited from this service.
이런 병실이 있고 해서 경제적으로나 또 정신적으로 많은 도움을 받았습니다.
The hospital increased the number of negative pressure rooms that completely sealed out viruses to prevent the spread of infectious disease. Plus, Incheon Medical Center is further expanding its public medical services with a new hospice and palliative care wing to provide better care to terminal patients.